Welcome back to Living 808. October is Breast Cancer Awareness Month, which is an annual campaign to increase awareness of the disease. Now, I'm here with Dr. Susie Chen, a radiation oncologist with the Cancer Center of Hawaii. We're talking about breast cancer survivorship today. Hello, doctor.
Hi, thank you for having me.
So what does it mean, survivorship?
Well, with improving technology and improving treatments and detection, there are more and more women who are beating breast cancer each day. So there's an estimated more than 3 million breast cancer survivors in the U.S. now. And with that, we have to think about how we're going to empower them, their friends, their families, to actually live healthy lifestyles in the future. So survivorship is mainly 3 different components. It's number 1, how to manage the side effects from treatment. Number 2, what is that healthy lifestyle? And number 3 is how do we continue our medical care for these patients?
Okay, so let's start with number 1. What are some of the side effects for breast cancer treatment?
So side effects really depend on the type of treatments a patient has. They can either be physical or emotional. So physical, there can be self-limiting, meaning things that can get better on their own, like hair loss from chemotherapy, or there can be more long-term side effects, like lymphedema, which is swelling of the arm from having had surgery to take out lymph nodes, and then radiation, which tends to have women have some swelling on the arm of the side where their breast cancer was treated. And there's also emotional side effects, anxiety, depression, body image issues, because these women have been through a lot.
Mm-hmm. I'm glad you talked about the emotional side effects, because you kind of forget about that. You know, you see and you hear about the physical side effects, but you forget that this roller coaster emotionally, right, that the patient goes through.
For sure, for sure.
What can be done to help with some of those side effects?
So there are many resources out there. Many of the big clinics now actually have survivorship programs for their patients. They're really pushing those types of how we live a healthy lifestyle to help with those types of side effects. Like I said, some of the side effects are self-limiting, like the hair loss. Your hair will grow back. But there's other long-term ones which may require more medical attention. There are things that help, like exercise, which is kind of the second component, and they all kind of go hand in hand in helping someone live a healthy lifestyle.
That was going to be my next question. You mentioned healthy lifestyle. So what are some healthy habits that we can develop to help?
Yes, for sure, that these healthy lifestyle tips are not just for breast cancer survivors, but for everyone. But generally what we say is that we want to have patients have a plant-based diet, which is low in animal fat as well as high with vitamin D and calcium. You also want to get exercise, usually 150 minutes a week, so that's 30 minutes 5 days a week if you can get that in. And all those things actually help decrease one's stress levels, which is also very important, going back to that emotional aspect. And all 3 of those things, decrease stress, a good diet, and exercise, actually have been linked to decreasing a chance of a woman's breast cancer coming back.
Okay, that's good to know, because those 3 things in general can just help you with all sorts of diseases, right?
Yes, for heart disease, which is still the #1 killer, it can definitely help with those types of things.
Okay. How do people make sure breast cancer doesn't come back?
So that's the 3rd aspect, is your continued medical attention. So women should at least see their physicians every 3 to 6 months for the first 5 years. If they still have a breast on the side that had the breast cancer, they should have a mammogram at least yearly. And if they've had a mastectomy, which is removal of the whole breast, they should at least have the other side checked with a mammogram yearly.
Okay, doctors, thank you so much.
Thank
I know
you.
this is a lot of information. We're going to have your information on our website in case people have questions. They can call, make an appointment. But throughout the month of October, we're going to be having a lot of these interviews just to remind people, being aware, of course, of breast cancer. Thank you. Coming up on Living 808, a roller derby challenge in studio.